When a mother hears that her unborn baby has a birth defect, it can be overwhelming. But with the comfort, support, and medical expertise provided by the UAMS Fetal Diagnosis and Management Program, she and her family immediately have somewhere to turn to.
Because UAMS has the main center for maternal fetal medicine specialists, they see more high-risk pregnancies and also those pregnancies that have babies that have an abnormality or something that is different that's going to need more medical care. And for that reason, this group was created to follow those patients, plug them into the subspecialties they need.
Sharing their stories are three families whose lives changed after learning their unborn child had a birth defect. Meet Philip and April McDaniel, who were expecting twins when they learned one of the babies had limb-body wall complex, the irregular formation of limbs, spine, the abdomen, and chest walls. As with most babies suffering from LBWC, baby Kendall passed away just hours after birth. DeAvery and Shayla Crawford's unborn son was diagnosed with Dandy-Walker malformation, a condition caused by an enlargement of the fourth ventricle of the brain. While it is virtually impossible to predict the baby's prognosis, with Dandy-Walker, there is risk for developmental delays, mental retardation, and movement disorders. Elizabeth Rodriguez and her husband were adding to their family when they learned baby Genesis had spina bifida, a disorder that occurs when the bones of the spine and skin do not close properly over the spinal cord. This birth defect happens in the first month of pregnancy and is relatively common. With the state's only certified high-risk maternal fetal medicine physicians, UAMS is a leader in fetal diagnosis and care. Our team of obstetricians, neonatologists, counselors, and nurses offers the best in care for each family.
The impact that this team has made on our lives and on others is it's overwhelming.
Dr. Wendell and his team they've really, like I said, they've really been like a family to us. They're upfront. They're not gonna, rush you. They're not gonna push you to the side. They're right there with you, and with the same care factor. They're just a family.
By using a family-centered approach, UAMS focuses on empowering the family with essential information so that everyone feels prepared and confident in caring for a child with special needs.
When families find out that their babies are different, they immediately feel alone and lost. And if we can come in and help bring compassion and guiding them through that, that's the ultimate goal. This is their pregnancy. It may be different, and their babies are going to have a long journey. But this is about this mom and the baby and the families, and we want every single member that's a part of that involved.
There's a lot of help. There's a lot of good doctors, and there's a lot of counselors that could help you and all that.
The UAMS Fetal Diagnosis and Management Program is about making the biggest difference in the tiniest of lives.
They actually brought her into me in the recovery room. I got to hold both babies, which they said has never been done before. Normally in a situation like that the baby does not even live outside the womb. Normally the babies, don't make it. But I feel that she hung in there to stay strong for her sister so that Kennedy would make it.
With the ultrasounds and him saying that it's not as big as it could be, and everything else was measuring fine, it's just okay, well, at least there's still hope. But either way, I'm still gonna love him, because he is my son, but.
Always.
With approximately 120,000 babies born in the United States each year with a birth defect, it is important for their families and others to know they are not alone.
I honestly couldn't imagine what it would be like for me not to have that support group.
They bring their life experiences into the situation, so it helps to make us feel more comfortable, like, okay, well, we know they've experienced something like this, so they know what we're going through.
You know, it was, the heart was there, the love was there, the caring.
They cried with us.
There were a lot of tears.
That's what really set it apart, was that, you know, even being in the recovery room when both the twins were in there, it was to see them all around the bed and they're all, you know, in tears, that they truly felt the same pain.
As the Crawfords found, many support systems are close to home. Through UAMS Angels, interactive video is used to provide long-distance care to pregnant women in rural areas of the state. With this program, many mothers can deliver with their primary obstetricians at their local hospitals.
We're from Ohio, so we don't have any family here. So it's just he and I. You really need family there for you when you're going through situations like this, and we're miles away from ours. So
it feels like, you know, we're just not a name on a piece of paper to them. So, you know, they look at us and they know who we are, they know what we're going through.
I couldn't have asked for a better team. The support and the love was amazing. You know, I came from a bad situation, and even though it was a bad situation, so much good came out of it.
Providing comfort, hope, and healing to babies and their families is our mission. If you need us, we are here and will be every step of the way.
Do everything you can to make sure it has a full life, and he can do everything, or he or she can do everything
any other child can do. And don't give up on them, that's for sure. Because they're gonna need all the support that you can give them.
And she's a special little baby. And she's gonna tell her story whenever she's, by the months, as she grows. As she grows.
Nothing was normal about this pregnancy, so all of us had to just wait until delivery to find out what was going on. So we just had to prepare for the worst, expect the best.
She's an angel. That's all I can say. She's an angel that God sent me.